Hi, I'm Matt, and welcome to the Strong and Healthy Rehab channel, a place to discuss all things rehab. In this video, we will discuss why a PT or PTA will tell you it depends when you ask them what to do for something. This can be a bit of an inside joke that all therapists tell one another at some point, but it is based in truth. The reason why we tell you it depends isn't because we don't know what to do, because as therapists, we know what to do for a pretty wide range of things. However, we tell you it depends because we don't know what to exactly do for you and your issue for several reasons. And let's get into them. The first reason is that often if somebody comes to us to ask, what do I need to do for something? They only give us a very little bit of information. Now, for example, someone could say, what do I need to do for shoulder pain? Well, that's a small amount of information, and we need to clarify things such as, where are you feeling the pain? So they could point to an area as well to say, my shoulder hurts here. Well, what is that area? Is it the area under their palm? Is it the area around their fingers? Is it the area around their thumb? That's a large area. We need to be a little bit more specific. Now, there can be some language difficulties and understanding because somebody who has less understanding of the human body may describe things differently than someone who has a higher level of knowledge and understanding of the human body. For example, as well, somebody could say, my shoulder hurts, but they're pointing to this area and can consider this the shoulder. Whereas we as PTs and PTAs could consider that the neck. Also, like where in the shoulder is it? Is it deep in the shoulder or is it more to the surface? So we're going to need a little bit more detail there. Additionally, if you're asking about pain, we want you to describe the pain because pain can be different based upon the different causes. Is the pain sharp? Is it dull? Is it achy, throbby, pins and needles, tingly, numb, sore? All these different descriptions of pain are produced from different things. Also, is the pain constant or intermittent, which means that it comes and goes? And this can be something that people have a hard time explaining because they may say, oh yes, the pain is constant, it's all the times, but there are times when I can forget about it. Or they may say, yeah, it's constant, but if I take something, the pain goes away. Well, to us, that means that the pain is intermittent because you're able to turn it off with doing something, or like you said, you can forget about it. Even how the symptoms came on. Did they just start up one day, or was it from an injury? And if it was from an injury, exactly what happened? Sometimes we do associate pain with an activity that may or may not had anything to do with that onset of pain because it happened close to the onset, or maybe we just associate it because it happened at some point in our life. An example of this could be somebody who was in a car accident and they're coming in saying, yeah, I was in a car accident and I have neck pain. Well, when was the car accident? Oh, it was 10 years ago. Well, if they've went 10 years with no pain, no problems, no issues, it may not be the car accident that really caused it. It's really hard to say. Also, somebody may associate it to something like saying, oh yeah, I hurt my back when I worked out the other night. But come to find out that they worked out 2 days prior and they had no symptoms again for that 2 days. What happened between that time of working out to that onset? And we need to get that information. Also, what kind of things make your symptoms come on or do they get worse? In what ways do they get worse? Is it every time that you do it? Also, what makes you better? Now, it doesn't always have to be pain symptoms. Sometimes people have some sort of loss of function, such as like difficulty walking, maybe reaching or moving a certain way. And we need to know those details as well. So what kind of limitation exactly that you're having. So, now with all that being said, you may be saying, well, I think I know what's going on because I have a diagnosis. Well, let's talk about why that may or may not help as much as you think. One way many people get a diagnosis is from the internet. We live in a time where we can find any information on anything in just a matter of seconds. Many people's first option when they have something going on is to go and search those symptoms and find out what is causing them. The issue with this is just mentioned, along those lines of what was mentioned before. That search engine may not get all the information. And additionally, that search engine isn't going to dig deeper into those symptoms to really figure out what's going on. What happens is that you type in those symptoms that you're having, and it just finds something that just lines up with it. It's just something that's very, very common. Now, you may be saying, well, what's wrong with that? The issue is that many conditions out there have overlapping symptoms, meaning that they share similar hallmark symptoms and they present very similarly. And to really confirm something, you have to dig deeper into those symptoms, meaning like what affects them, the quality of them, and even maybe perform some testing. And unfortunately, that search engine doesn't really do that. But what if you saw someone like a doctor or a chiropractor or maybe even another PT and you got a diagnosis from them? I will say that is much better than just looking it up online, but I want to let you know that there are some limitations to that. And the biggest one is that we don't know how thorough that other provider was in their examination of you. One thing could be that the other provider had a level of bias. And this comes into play with a few things, such as sports. So say that you're a runner and that you're going to see the doctor for your knee, and the doctor finds that you're a runner, and they could say, oh, well, it's because that you run, so just lay off of the running for a while and you should be fine. Or maybe that you have a very physical job. You're going in there with your knee, and the doc finds out that you work construction. Like, oh yeah, it's because you have this real physical job. That's why you have that pain in your knee. Or even age can play a component in it. So that you're going to see the doctor and you're younger, you're a teenager and having that knee pain, the doc could say, well, yeah, it's just growing pains. Or on the flip side, you're much older. Oh, well, it's because that you're older and you got arthritis in there. Now, these things may be true, and they could be contributing to the symptoms and things that you have going on. However, that needs to be a part of the examination to understand. Do those things like the sport or your work or even age have a factor on your symptoms of what having going on? Another one can be that does that provider really rely on imaging, things like x-rays and MRIs? I will say, these are amazing devices and they do have their place. They can be very, very beneficial. However, just looking at a picture may not tell the full story. And there is evidence out there that what is seen on an x-ray or MRI doesn't match up to what the patient describes. Again, they can be a part of the examination they provide, but if that's the only thing that they're relying on, it may not tell the full story. Lastly, again, how well did they do that examination? How really did they get in there? Did they just come up to you and just like poke on you and say like, oh, is that sore? Because you said, ouch. Well, oh, you just got a problem right here. Or maybe they grabbed your arm and twisted your arm around and said, oh, you just got this. Again, that may or may not have been a good examination. I will say, we all do have a level of trust in one another that they did a good job with you. However, in healthcare, it is very important that we verify what the person before us did, just in case something was overlooked or missed. And even there could be a change in things over time. So between that time that you saw that doctor or that chiropractor, that PT, to when you talked to whomever or you came in, what possibly changed in that time? So things, again, could have changed. It means that something's going on differently. Now, we do understand that you do have that diagnosis, but we also want to have a good understanding of what they were thinking, what they came up with, and either confirm that diagnosis is correct or figure out one for us to be able to help you. Lastly, a big thing that we need to do is to have a follow-up with you to make sure that whatever we gave you is helping you. This is a big part of any treatment that we do. We want to see if the things that we gave you actually get the response that we want. And if we don't get that response, that means we need to change something up to get that response that we want. What often happens is somebody asks us what to do, we tell them, and they go off and they don't check back in to let us know, like, hey, this is helping, or no, it's not. And what happens is, like, if what we gave you didn't help, that person could end up saying, oh, well, this didn't work, so that means PT's not going to work. So they just end up just chasing other things. So it could be ineffective treatments like the things that you see on social media, or unfortunately going for a surgery that they may or may not need. We always want to make sure that we give you the exact things to help you. And that means that we need to do, again, that thorough examination of you to fully understand what's going on. And at times, to fully understand something, we need to have the time to fully understand it. And that time could be just a few minutes to several days, because sometimes it does take a significant amount of time to really understand what affects your symptoms, what gets them to improve. So yes, if we give you something, we want to follow back up with you to understand, again, did that actually help, or do we need to look at something else? I will give you a bit of a warning that many times if you ever ask a PT or other healthcare provider or somebody like a personal trainer, that they may be hesitant in telling you what to do for something if you just hit them up with that, oh, let me pick your brain on this, or I just want to ask your advice. The reason is that often the people who are asking don't value that information that they receive. I'll say we as PTs and PTAs have spent a lot of time in studying and understanding how to treat people with all these different conditions. We've sacrificed our free time and spent a lot of money to gain this knowledge. So we have a very, very high value in the information that we have and the information that we give. And what often happens is that someone is asking us what to do for something. They either want to just confirm what they already believe in, and what ends up happening is that we can tell them something that doesn't line up with their belief, and what we tell them, that when it doesn't line up, they just reject what they tell us and they go off just to find somebody or something that confirms their belief. Or they just flat out don't do it. So we give them that information, hey, you need to do this. They say, oh, thanks, and then they toss it aside. And I will say, this is very frustrating as a provider, that we tell somebody exactly what they need to do, and then they don't do it. And then eventually, as this keeps happening again and again, we just quit giving it out, because we know all that effort that we put in with these people that just ask for it and don't do it. Well, I'm not going to waste my time and effort. I'm going to give it to the people who value it, who value the knowledge and effort that I give to them. There you go, everyone. That's a bit of a breakdown of why you're going to get that "it depends" answer whenever you ask a PT or PTA or any kind of health provider what to do for something. It honestly really boils down to that we only have a little bit of information from you about what you have going on and trying to understand your issue. We need to do a deep investigation to, again, fully understand what is going on, what is causing it, and to give you the best sort of things that's going to help you with your condition. Thank you for tuning into the video. If you enjoyed it, please hit that thumbs up button. If you have a question or comment, drop them down below, and please consider subscribing to the channel, because all this information that is provided is to keep you strong and healthy.